Okay, so this segment started off by talking about peptides functioning as neurotransmitters. So opioid peptides are endogenous substances, meaning they're in the body, and they resemble those of opiate drugs like morphine. Some examples are metenkephalin and luenkephalin. Another group that were discovered is in the periphery nervous system, and especially in the gut. And they participate in synaptic transmission, and some of these are vasoactive intestinal polypeptides and neurotensin. And then there are also pituitary hormones, which include oxytocin and vasopressin. So neurotransmitters can also be gases that dissolve in water. An example is nitric oxide, and they are produced outside axon terminals, especially near the dendrites, and they are not held and released exactly from the vesicle like other neurotransmitters are. And it does not interact with membrane-bound receptors on the surface of the target cell, but it diffuses into the target cell and stimulates the production of second messengers. So drug effects. So the effect of a drug depends on the action site and the dose that is given. So drugs that people abuse, like heroin and cocaine, have a different effects than drugs used in medicine, like lidocaine. So drugs of abuse, like the cocaine, alter the brain by changing the enzymatic activity that goes on. And they spread widely throughout the body, and they can activate more than one receptor, but they select which receptors they interact with, depending on the shape. So it's like a lock and key. It goes in and activates certain receptors that it fits into. So, like I said, they can have different receptors. So things like GABA have a variety of receptors. And drugs can bind strongly to one receptor and weakly to other receptors, or just completely not bind to any receptors at all. So drugs change by the dose. So an example of this would be an anxiety drug. So the dose affects how it binds and affects each individual. So binding affinity is the degree of chemical attraction between a ligand and a molecule. And a ligand is the binding surface where the receptor goes. So lower dose drugs have a lower affinity and will only bind to few receptors, while higher dose drugs bind to more receptors and are strongly attracted. So efficacy is the propensity of a ligand to activate the receptor to which it is bound to. So agonists have a high efficacy and antagonists have a low efficacy. There are also partial agonists, which are drugs that are produced at a middling response. So it's a combination of affinity and efficacy, and it binds, where it binds and what it does determines the overall action of the drug. So people can build up a drug tolerance, and the effectiveness as the drug goes down. So a tolerance is usually built up when someone takes large doses of drugs for a long period of time. So there's also metabolic tolerance, which is the body becomes effective at eliminating the drug from the bloodstream before it is able to reach the target cell and produce a response in the body. Functional tolerance, the target tissue inside the body itself builds up a resistance, so it doesn't allow itself to have as much as a effect when the drug hits it. And repeated exposure to agonist drugs causes neurons to downregulate, meaning they become less sensitive. And this is usually done by agonist drugs, while antagonist drugs usually upregulate. So each drug reaches the target that it wants to aim for at different rates. So a bioavailable is meaning that it's referring to a substance that is usually a drug that is present in the body in a form that is able to interact with psychological mechanisms. So like an intravenous injection or smoking, something that directly hits your bloodstream. So the liver metabolizes drugs as well as the kidney and the lungs. So the faster these organs do that, the faster the drug leaves your system, eliminating the response. So biotransformation is the process where enzymes convert a drug into a metabolite that it is itself active, possibly in ways that are substantially different from the actions of the original substance. And drugs can be stored in like holes in your body or little like crevices, and they can come out later if they're activated and have a response then. So people have to be careful about that. And pharmacokinetics is a name for all the factors that affect the movement of a drug into, through, and out of the body. So, like I said, the drugs can store themselves, be removed at different rates in between each individuals, and create different effects depending on the receptors they activate. So local anesthetics block sodium channels to stop neural transmission in pain fibers. So an example of this is lidocaine, which is something that a dentist uses to numb up the tooth area when he's working so that the pain can't hit the roots of your tooth and you won't feel anything. So some drugs also modify the presynaptic neuron, which changes the system that creates a signal which causes you to feel the effect of pain on the body. So the effects on transmitter production, they affect transmitter release, and they affect transmitter clearance in the body. Drugs can also inhibit enzymes that neurons use to synthesize the neurotransmitter. Drugs can block axonal transport and prevent materials from reaching the terminal so they can't create a response in the body. And this makes no effect on the postsynaptic neuron. Other drugs can affect the body by not allowing neurons to store catecholamine transmitters for later release. There's also calcium channel blocker drugs, which block calcium influx that normally drives the release of a neurotransmitter from the synapse. Some toxins can prevent the release of certain types of transmitters, so they can never elicit a response. Like this is an example of this would be Botox, which blocks calcium ions, resulting in muscle paralysis. So an autoreceptor is a self-receptor, and it tells the axon terminal how much transmitter has been released, and drugs that alter this cause false feedback mechanisms to flow throughout the body, and they make the cell release more or less of a certain transmitter. So caffeine blocks receptors for adenosine, which increases catecholamine, which leads to arousal. And drugs can interfere with transmitter reuptake by blocking receptors or inhibit degradation. And drugs can also modify the postsynaptic cell, which causes a direct effect on transmitter receptors and affects cellular responses within the postsynaptic cell.